Welcome to Empowered. I'm Elizabeth Namofsky. On one of our previous episodes of Empowered, we talked about the importance of healthy teeth and a healthy mouth. April is Dental Health Month. It would be prudent to continue the conversation about the connection between a healthy mouth and a healthy body. We'll discuss how a dental examination could find health issues that are not dentally related. Also, with the increase of cancer patients receiving treatments, we'll discuss what they can do to maintain their oral health. Today's topic, is it dental? I'm joined by Dr. Willa Chu. She's a dentist and the owner of the Concourse Dental Center in Toronto. Dr. Chu, welcome to Empowered. Thanks for coming on again.
Well, thank you very much for the invitation.
So I see you on a regular basis. And growing up, my mother never wanted me to see a dentist because the place where she came from, you'd go to see the dentist and they'd pull out all your teeth. So why should people routinely visit a dentist?
Well, that's a great question because a lot of patients come in with the same idea. However, if you think about it globally, the top three conditions in the world are common colds, cavities, and gum disease. So your dentist actually takes care of the two of them, the gum disease and the cavities. So not only can we do that when we come in and check your mouth for other problems like cancer and infections, we also can help you prevent these problems. So we can screen them and spot them prior to them becoming a big issue. And once we find them, we can treat the dental disease or other issues so they don't become more severe pain and infections.
So what happens when I go for a checkup at my dentist's office?
So the first thing that we do at our office is that we don't look inside your mouth first. We do an oral cancer check. We do what I call a lump and bump search. A lot of our patients, unfortunately, don't have medical doctors, so we feel that it's important for us to at least do what we can in the area that we work in. So looking at your thyroid, your neck, and actually one of my associates found a basal cell carcinoma on her patient. So it was just a chance finding, and the patient was very grateful. The other thing that we do is to look inside the mouth for conditions that don't belong. So we're trained to recognize what's normal so that we can see what's abnormal. And based on those findings, then we'll discuss, the treatment needs that you have.
So what's the importance of a healthy mouth, other than eating?
So obviously you need your teeth to eat. But other thing that we spoke about last time was that your mouth gives you your facial profile. It gives you your ability to speak. So if you've ever spoken to a 6-year-old or a 7-year-old, you'll know that when they're missing their front teeth, they pronounce words differently. So enabling you to speak and pronounce is very important in communication, especially in the world of Zoom, where you don't see each other that often and it's all through internet.
Mm-hmm.
Having the enunciation is really important with your front teeth. The other thing that the mouth does is it starts the digestive process. So people that have medical conditions that create dry mouth, they don't have the ability of the saliva to help them digest their food as quickly as somebody who has a normal salivary flow. And lastly, for us on media and stuff, we need our teeth to smile. Okay, so it's amazing how when we do a little bit of cosmetic work on a patient, that my staff, as the patient leaves, will say, "Did you see her smile? It's so big." And she feels so much more confident. So I think that's one thing that dentistry can offer. But better than that is to make sure what we do stays healthy in the mouth.
So we have about a minute before we go to commercial break, and we can come back to this again. But what does this mean? A healthy mouth, healthy body. How are they correlated?
So your mouth, you have to remember, is the entranceway into your body. When you open your mouth, millions of bacteria enter. And when you're talking, you're spreading and sharing millions of bacteria. So in order to have some catch system to make sure that that bacteria doesn't get to the rest of your body, your mouth is the catch basin. So we work in the mouth to create a healthy environment so the bacterial load doesn't increase so much that it can cause problems elsewhere. Inflammation is also something that we look at in the mouth because in the medical community, inflammation that grows and stays is harmful. And we all understand that. So how do we as dentists help you keep your mouth healthy, free of inflammation, so that this bacterial load doesn't pass on to the rest of your body and create havoc elsewhere? And I think that's what we're going to talk about later in the sequence of, is it dental? Because
Absolutely.
not everything in the mouth is dental.
Absolutely. So please don't go away. We'll be right back with more Dental Talk.